If you're dealing with something like Hashimoto's, rheumatoid arthritis, lupus, or symptoms that feel like they're heading in that direction, you've probably experienced this. Your symptoms don't stay the same. They flare up, they calm down, and then they come back again. And it leaves you wondering, why is my body doing this? In the next few minutes, I'm going to explain what's actually happening in autoimmune conditions and where inflammation fits into that picture. And if you want to understand how we approach this in a structured way, I'll show you exactly how we help patients start making sense of this and move forward. I'm Dr. Adam Zuckerman, founder of Fuel Functional Health, and I work with people dealing with autoimmune conditions, chronic fatigue, digestive dysfunction, who feel like they've been given a diagnosis, but not a clear explanation. And one of the most important things to understand is this. Autoimmune symptoms are not random because most people are told your immune system is attacking your body. And while that's true, it's not the full picture. And without understanding the full picture, it's very hard to know what to do next. So what do people do? They try to manage symptoms. They try to avoid triggers. They try different diets or supplements, and sometimes things improve. But the flare-ups keep coming back. Here's why that's not working. It's because autoimmune conditions are not just about isolated flare-ups. They're part of an ongoing cycle inside of the body. And if that cycle isn't understood, it's very difficult to break. So here's how we start looking at this differently in our practice. Autoimmune conditions involve a loss of immune balance. Your immune system begins reacting to your own tissues, and that reaction creates inflammation. That inflammation doesn't just stay contained, it can lead to tissue irritation and damage, which then sends more signals back to the immune system. This creates a loop. Immune activation, tissue irritation, more inflammation, more immune activation, and over time that loop can sustain itself. And this is where chronic cellular inflammation becomes important, not as the only cause, but as something that can amplify and sustain this cycle, which is why symptoms can flare, settle, and then return again. The reason this approach works is because we're not just reacting to flare-ups, we're working to better understand and stabilize the environment that's contributing to that cycle. And when that internal environment becomes more balanced, the intensity and frequency of those patterns can begin to shift. If this resonates, start with our practice orientation video. It explains how we work with patients and what to expect. Simply comment "Welcome" and I'll send you the link. It walks you through how we evaluate patterns like this and where we typically start, so you can begin to understand what your next steps could look like.